The novel coronavirus pandemic has stretched healthcare system to the brink, but patients are getting sick from other diseases and injuries, and doctors are looking for other ways to treat patients while minimizing contact. So many countries have shifted to telehealth and telemedicine. What is telemedicine and telehealth? Telemedicine can be defined as use of telecommunication technology and software for treating patients and monitor the clinical outcomes. Telehealth is a more broader term used to define all medical services and education delivered digitally. In this video, we're going to introduce the Doctor on Care telemedicine platform. Number of research studies found that telehealth and telemedicine found to be effective alternatives and satisfying for both patients and provider. Telehealth is a solution for people who are in remote and rural areas. Now they advocate telehealth as low-cost and convenient option for such areas, as well as for families with busy parents.
Well, telehealth now means that we can deliver care for patients how they want and when they want, and also where they want. You see, telehealth means that we can extend our reach to people who might need care, but really can't access it. A good example of telehealth is maybe, say, if a patient has a video conference appointment right from their home or from a regional hospital too, directly to a specialist at a main hospital. Telehealth can also be delivered by using the simple telephone, also by sharing information. For example, sending a digital image by email is another good example of telehealth. Now, the benefits of telehealth are just huge. The sky is the limit. We have gains in patient treatment, efficiency, and time. We have gains in terms of cost savings too. Especially nowadays, many patients are asking for telehealth visits. As you know, it's a real challenge to arrange for transportation, parking, and taking leave off of work. You no longer require extensive hardware to participate in a telehealth consultation. See, in many cases, a smartphone with a reasonable camera and internet connection can be used for video consultation or to share clinical information.
Dr. Malawarachi is a consultant OMF surgeon and telehealth health expert at Telehealth Global. He is the founder of the SmartCare Dental and Doctor on Care virtual platforms. He has published many articles in telemedicine and teledentistry. He would like to share the experience in Doctor on Care and SmartCare Dental virtual platforms.
It is really excited to launch the Doctor on Care telemedicine platform for developing countries like Sri Lanka and India. Indeed, it's a great pleasure and honor to be part of the virtual hospital. Actually, Doctor on Care are equipped with really cool tools that can be used to start up your virtual practice within your own comfort zone. I think almost all of our specialties can benefit from telemedicine. It really doesn't matter what your specialty is. It is in what area of your specialty could you use telemedicine.
Research shows that the assessment and diagnostics performed via telerehabilitation are equivalent in-person services, and the treatment outcomes that you can achieve via not inferior to traditional services.
Hello Tanya, how are you?
I'm not well. I'm having a terrible headache.
I believe there's no need to worry here. Prescribe some medicines, you can get them from the pharmacy.
Actually, Doctor on Care connect physician to physician, a specialist to GP, and or a second medical opinion, and it connects patient to physician and physician to patient. We are also able to reach large communities of people, which is really exciting for population growth and just looking at global health in general. Actually, I left from hospital 2 years back and joined Doctor on Care telehealth program. All day I am writing to patients, respond to messages, talking with them, and I feel that I have more engaged with them. Actually, I have deep conversation than just doing face-to-face clinic, and I really enjoy doing that. Also, it is a great pleasure to work with Dr. Ranan and his team in Doctor on Care. Move your hand like this. Do you feel pain? Can you show me your eyes like this?
Well, the advantages of telemedicine are high-definition transmissions, providing us incredible clarity with regards to what we so need. In essence, we are at the bedside, even though the bedside is at a great distance, perhaps, from a tertiary care hospital. So the advantage is we can provide rapid, accurate, real-time advice and provide our experience and our expertise to referring clinicians and doctors. We know that all tertiary care hospitals have resources and expertise 24/7. So telemedicine provides to those outlying clinicians the access to pediatric expertise 24/7.
How has your experience with virtual consultations with the Doctor on Care app been?
Since adopting the Doctor on Care, I've found that I'm able to meet with my clients much quicker and on a more regular basis. The call quality has been fantastic. There's no sputtering or freezing. This is always a concern when moving to an online platform, but I have to say I've been pleasantly surprised.
Doctor, what has been your experience with ordering lab reports and prescribing medication?
Well, there is a built-in function right into the app. Prescribe medication and send it to the pharmacy for pickup or delivery, and it's very simple to order the blood results, and I receive the results right in the app on my patients.
Now, Doctor, do you feel that the app is secure enough for electronic health records?
The app is HIPAA compliant and heavily encrypted. All of my patients' charts and healthcare information is secure.
With all of that ease and security at your fingertips, how has patient follow-up been?
Surprisingly simple, with the office appointments, there is scheduling difficulties. You set up follow-up, it remind the patients, and scheduling is so easy and much quicker.
How has it helped your practice? Dr. Alex, have you seen a revenue increase?
I've actually been able to grow my practice. People really want to be able to see a doctor virtually and get their questions answered quickly. Doctor on Care has helped me increase my patients by 35%. She's fine, blood pressure is fine.
And Dr. Ranjan, how has it helped your practice? Have you seen a revenue increase?
Actually, Peter, apart from the revenue, but most important to me is retaining good patients. Patients that show up for appointments and follow-ups completes their labs, and it's a very good way. Actually, with the Doctor on Care, I have seen just that people have busy schedules, and this fits into their lives so much. It is so much easier than physical appointments. I have also increased my practice like Dr. Alex, and I am retaining 40% of those new patients.